The flu outbreak started when we had 12 patients confirmed with flu on the ward. The ward was isolated. We had to contain the virus. We had 12 patients cohorted around the ward in the bays and the side room, and the staff had to wear protective equipment including face masks at all times. Infection prevention fully assisted the ward, give all the information so we could give advice to all the support services around, such as porters and phlebotomists coming onto the ward. It was a very daunting and anxious experience for the staff and the patients and the relatives coming onto the ward at that time.
To stop the spread of infection, the team used infection control measures such as wearing masks and gloves and aprons, and some of the bays were closed as well. Some of the staff were affected by the outbreak. I was glad I'd had my flu vaccination. Some of the staff members hadn't had their flu vaccinations, and that could have prevented them getting flu and also prevented the spread around the ward.
I wasn't worried at the time. We were using infection prevention measures and I didn't think I would be at risk as such. I've never had the flu, common colds but not the flu, but I didn't have the jab that year because previously I'd had the jab and fell ill after it. It put me off having it again. I had no idea what I was letting myself in for. It was horrendous. I couldn't move, I had to stay in bed. Eating and drinking was a hassle. The headaches were horrific, and I can honestly say I felt I was going to die. I'm a single mum to 3 boys. They were really worried about me. I had to rely on them for everything, cleaning, shopping, cooking meals. I was off work for 3 weeks. This had a big impact on the team on the ward. One staff member down is a big issue when you're on a ward that's so busy. I've had the flu jab this year with no side effects at all, maybe just a sniffle. Having had the flu, I can really understand what our patients feel like. It's serious, it's not just a sniffle. Infection prevention goes a long way, but it can't fully protect you from everything, unfortunately. I would advise anybody to get the flu injection.
The outbreak was unpleasant for the patients as well. Some of them unfortunately contracted the flu on the ward, and that meant that they had unpleasant symptoms and ended up staying in hospital for longer. And also they were affected by the infection control measures, such as not being able to be discharged or not being allowed to have visitors to the ward.
This is what a patient told us it felt like when they had flu. I felt terrible, I felt weak, I was isolated and really frustrated because my recovery took longer.
The effect on the team, we felt isolated, we were trying to contain this virus within the ward. Obviously restrict visiting, we had to restrict just social workers coming onto the ward. The patients we have on the ward are very frail, fragile, elderly patients. So getting flu on top of these conditions have a very big impact on the care that we give to the patients.